So, as Hein mentioned, I was elected chair of the New Zealand Medical Association in May of this year, and all the talks and all the learning I've been doing about leadership made me realize, so now I'm actually in some position of leadership. What does that actually mean? And I was taught that leadership begins with values. So here's the mission statement for the New Zealand Medical Association. This is what we're supposed to be doing. And I looked at this mission statement and I thought to myself, well, that's fine, but I'm struggling with this word profession and professionalism, and what does it mean? And so I'm in medical education and I had to look around the literature, and there's actually 159 definitions of professionalism, but what they have in common is that we should be putting the patient's interests above our own interests. So that made me start to think about the history and sort of how we got here. And so I looked through this, and actually the first term about professionalism was 1676. The father of economics, Adam Smith, coined the term of professionals and started talking about professionals in general. Code of ethics, you can see, was developed in around the 1700s, 1800s. The NZMA, just a little plug, was 1886. It was actually formed here in New Zealand, one of the oldest institutions. We merged with the BMA. The Declaration of Geneva came out in 1946, which I'll speak about in a moment. And I think I have this date wrong. I understand the ASM split away from the NZMA in 1989. Is that right? Was the formation of ASMs in the date of it? We were your midwife, yes, so apparently. But anyway, this started to make me think about the values, actually, and the values of our profession strongly came home to me 4 days after I was elected to be chair. I went to the Australian Medical Association meeting. And there was 1,500 people in the room, and I was just sitting around chatting before it started. And I had the president of the American Medical Association sitting on this side, and I had the president of the British Medical Association sitting on this side, and we were just chatting. And suddenly someone came up to the podium and said, "Please be upstanding." And we all kind of sort of, what? Okay, we all stood up. "Please recite after me." And 1,500 doctors stood up in the room and had to begin the meeting by reciting the Declaration of Geneva. And I'm going to tell you that it sent little hairs went up the back of my spine when I had to stand up vocally with 1,500 of my members and read out, "I pledge to consecrate my life to the services of humanity," is the opening line. These are our values. The Declaration of Geneva is the modern version of the Hippocratic Oath. After World War II and some of the atrocities that occurred, the World Medical Association got together and think we need a little bit of a refresh of the Hippocratic values, and that is the Declaration of Geneva. It's actually been refined 4 more times, and at the meeting 2 weeks ago in Moscow, we've just started a working group that's going to do another slight modification of it. But these are our values. And if you want to call yourself a doctor, if you want to put doctor in the front of your name, you have to be able to stand up and say, this is what we do. So how are we doing in 2015? How do you think as a profession we are doing to live to these values? I would argue that I think we're doing fantastically. We have people like Philip Bagshaw in our profession. We have some amazing altruistic examples. I don't know a single doctor who comes to work and wants to harm a patient. Every one of my colleagues that I work with genuinely cares for the patients that they work for. I sat in a group of GPs recently at a funding meeting, and I just asked them, I said, "Excuse me, just how many of you sometimes don't charge a patient because you know they can't afford it?" What percentage of GPs do you think put up their hand? 100% put up their hand about they don't charge patients sometimes because they can't. It made me think about if I did that with 100 plumbers, 100 mechanics, 100 lawyers, etc. I mean, there's some fantastic examples where we do live our values as a profession. But maybe, just maybe, there's also some examples where we don't necessarily live our values. And maybe by not being professional and living our values, maybe in some way that's harming us in the concept of leadership. And maybe the values are becoming sort of guidelines now, and we adapt them. And this isn't the first person to say something like this. I mean, our professionalism, you could argue, is under threat. These are just some of the things that have been happening lately. Even the whole concept of e-health. You know that there's a competition in the US at the moment for a Star Trek tricorder. It's a handheld 3D MRI scanner linked with web diagnostic software. It's a competition, $10 million prize. The prize will be announced in December. The semifinals were announced in September. There are already 6 groups who have a fully functioning model. Doubling time of health technology is 14 months. So 5 years from now, if there's a handheld 3D MRI scanner with web diagnostic software, how do you think that's going to affect our profession as a profession and what we do and our values? We have third-party funding, which I will talk about in a minute. We have lots of comments about task substitution and how that's affecting our professionalism. We have regulation, as you've just heard Helen talk about what drugs we can choose and how we can use it, etc. So our professionalism has challenges and is affecting the way we work. In some ways, the invisibility of self-regulation. There's a huge hue and cry from the public taxpayer. We allow you to self-regulate yourselves. Why are there still incompetent doctors? So you have a bit of a hue and cry about us as a profession. Corporatization. We have non-medical groups buying 51% shareholding of general practices. In other words, you have a businessman buying a group of patients, like a herd of cows, to milk for a return on their investment. How does that affect our professionalism, whereas doctors were supposed to put the patient's best interests first? And greed. You heard Philip talk about the concept. Michael Grigg, when he was president of the College of Surgeons in Australia last year, had a campaign. And his campaign was excessive charging campaign is unprofessional. Greed is unprofessional. I recently got involved in some of the Southern Cross negotiations with some surgical specialties in Auckland, not to be named, and there were some examples where behavior could be considered unprofessional in the way we were working in our practice. And that's a challenge to our profession. That's a challenge to what we do. It's a scandal that those you HMOs treat patients like this with so little respect, like they're widgets in the healthcare assembly line. And the response, those aren't patients, those are the doctors. Matthew Winnie, this was 2012, the American Medical Association. He gave a lecture and he said the short history of the future of the medical profession. Again, Michael Grigg, president of the College of Surgeons, this last March in a meeting in Melbourne, his presentation title was a little bit better. He reckons there's 5 years left in the medical profession. After that, we'll no longer have a medical profession, was his dramatic pronouncement basically about it. Or Tallis. Tallis blames the imposition of targets and bureaucratic demands, the multiple pressures of clinical practice in which the God-like consultant has become the cog-like consultant, and the excessive requirements of transparency and accountability fuel a lack of trust. Or closer to home, in an article in the New Zealand Medical Journal this year by Richard Hamlin, in an age less deferential to healthcare professionals, the risk of reduced trust is countered by increased transparency. So you get the concept of accountability versus trustworthiness. Comment that I've made to anyone who will listen, including the minister, I said, here's an example. If you think your partner is having an affair on you, you can probably check his or her phone for the texts. You can probably check the mileage on the car. You can probably check the emails. But at a guess, that's not going to increase the trust that you have in your partner, is it? It's going to decrease the trust that you have in your partner. Accountability is the antithesis of trust. Again, you heard Phil Bagshaw say that this morning when he said accountability. Now, accountability is different than transparency. Transparency is good. Transparency says we want to be open to what we do. That'll improve quality and make sure we're providing the best possible care. But accountability reduces our ability to do what we do. So here's an example. Let's say you want to build a beautiful dining room table, and so you research and you find a guy who makes really nice dining room tables. You probably have 2 choices. One way is to trust him that he'll make a really nice dining room table for you. You might even want to just sit in and watch him when he makes the table, maybe. But accountability would be you'd sit there and sit down with them and say, okay, now how are you going to select your wood? How are you going to get your wood delivered? Which company are you going to use? Which nail selection are you going to use? Can I just check this, this, and this before you actually drill it all together? My guess is your dining room table isn't going to be any better. My guess is it's actually going to be worse. And that's accountability as opposed to transparency. Okay? Lovely little quote, this one. GPs now, 65 to 70% of the funding of a GP comes from the state. So when the patient walks in the room to get their state funding, they have a bunch of tick boxes they have to tick off. And so what's starting to happen now when a doctor walks into a GP's office is the GP starts looking for, let me see, I've got this. Right, I'm ready now. What can I do for you? After I've ticked the boxes. I went and met with the Grey Power executive in Auckland in early October. And that was an amazing experience. I said, hi, I'm here from the medical profession. Anything you want to say to doctors? Well, they rolled up their sleeves and they said, maybe we'll take this one by one. And they went round and each one of them made sure they gave what they wanted to say to doctors from Grey Power. And do you know what the commonest answer I got from the executive? 3 of them all said it to me. You know what? When I go to my doctor, I just want the doctor to look me in the eye. Not to look at the computer screen, but to look me in the eye. They've forgotten who we are, was the response from the Grey Power executive. So it's the concept of trustworthiness. The antithesis is accountability. So what about trustworthiness? What is trustworthiness? Professor Onara O'Neill in the UK says trustworthiness is 3 things. Trustworthiness, if I think you're trustworthy, I think you are competent, you're honest, and you're reliable. I make that little assessment. So are we as a profession trustworthy? Does the public still trust us? Well, I would say yes. I mean, 98.4% of us are competent and fit to practice by all the statistics. We have recertification programs, we have CPD programs, we have review of practice reviews, etc. We have transparency and we're open to transparency, but we must do more. We must be open to having our competency measured, and we must make sure that we are competent because that's the core component of our trustworthiness. Are we honest? Well, the HFANS, Health Funding Association of New Zealand, last year announced that they were going to start doing audit of private billing of all the private insurance companies. Why? Because they had examples where, gee, that's funny, you billed a gallbladder operation on that patient. You did that 2 years ago. Do they have 2 gallbladders, do they? And there were a few little examples. In the PHO audits that people have done, I'm on the clinical governance committee of ProCare GP, PHO, and we have examples where some inappropriate practices are occurring that are dishonest. And we have multiple examples of excessive charging. So for the sake of our trustworthiness, we need to remain honest as a profession. And then, of course, are we reliable? Contextual ethics. We can all sit here and say that, yes, we will put the patient's best interests first, but then when it's our interest versus the patient's best interest, maybe those values potentially could change. So what can we do about this? What can we do as a profession to do something about this? Well, one of the first things I think what we need to do is we need to speak together. There are 89 different medical groups in New Zealand that will speak out on behalf of doctors. The Nursing Council did a consultation document on nurse prescribing. They said, what do doctors think about nurse prescribing? They received 39 submissions. 11 of those submissions came from medical groups. 6 of those 11 were against it. 4 of the 11 supported nurse prescribing, and 1 we read twice, and I'm still not quite sure which one it came down at. Okay? So what do you think the Nursing Council thinks doctors think about nurse prescribing? There are 89 different medical groups. I think one of the first things what we need to do is we need to start to talk together more. We need to start to be a family. We need to start to be brothers and sisters. Behind closed doors, we need to discuss some of these issues, agree to disagree, but then when we step out, we need to speak together. We need to actually communicate better as a group. And so I've just sort of coined this little term like man up, the concept of doc up, maybe. Going back to the values of the NZMA of professionalism, unity, and values, I think strongly we need to continue to work in the best interests of the patients, always. I think we need to speak up, but speak up together as one voice and have conversations together. And I think for quality, for our trustworthiness, we need to be open to transparency and the competency of how we practice. Because ultimately, if we are trustworthy, if we are transparent in the way we practice with our patients, if we collaborate together with all the other groups, putting the patient's best interests in first, and we put the patient in the center, that's what we'll end up providing to our patients, which is ultimately what they want, and is the only thing that is going to protect our profession in the future. 40% of patients who present to GPs, there is no diagnosis. We don't know. The patient's not coming to doctors for a diagnosis. The patients are coming to doctors to be cared for. How do you care for someone? You have to listen to them, you have to understand, and you have to reassure them. That's the only hope of our future medical profession. If we continue to keep our listening, our understanding, and our caring is the one thing that we're not going to be replaced by computers in everything that we're going forward. So thank you very much for your time. I'm happy to have a discussion or continue at lunch. Thank you.